Is your DLBCL lymphoma in complete or partial remission? What's the difference? Imagine hearing that your lymphoma has responded to treatment, but what does that really mean for your health? When doctors talk about remission in diffuse large B-cell lymphoma, they're describing how much cancer is left after treatment. It's a way to measure progress and plan next steps. Complete remission means that after treatment, all signs of the lymphoma have disappeared. This includes no symptoms and no detectable cancer cells on scans or tests. It's important to understand that complete remission does not guarantee a cure. Tiny numbers of lymphoma cells might still be present but are too small to see with current tests. That's why some patients in complete remission can still experience a relapse later on. Still, most patients in complete remission have a very good outlook, with fewer than 20% relapsing within 5 years. Achieving complete remission is often the goal of initial treatment because it indicates a strong response. Partial remission, on the other hand, means the lymphoma has shrunk significantly, usually by at least half, but some cancer cells are still detectable. In this case, the disease is still active but less severe. Patients in partial remission might need additional treatments, like more chemotherapy or radiation, to try to reach complete remission or better control the disease. Doctors often use imaging scans and sometimes biopsies to tell the difference between residual active disease and changes caused by treatment. Remission status is very important because it guides future treatment decisions. If someone is in partial remission, doctors might recommend further therapy to improve their chances of complete remission. If a person remains in remission for at least years, it's a very positive sign for long-term health, as about 80% of patients stay in remission that long. The risk of relapse is highest in the first few months after treatment and decreases over time. In cases where lymphoma does not respond to initial treatment or comes back after remission, more intensive options like CAR T-cell therapy or stem cell transplants might be considered. It's essential to remember that each person's situation is unique, and ongoing monitoring helps catch any signs of relapse early. In summary, complete remission means no detectable lymphoma after treatment, which is the best outcome but not a guarantee of cure. Partial remission indicates the disease has shrunk but is still present, often requiring further treatment. Understanding your remission status helps your healthcare team plan the best course of action and gives you a clearer picture of your prognosis. Always consult with your medical team for personalized advice and follow-up care, as every case is different and medical advances continue to improve outcomes.